Hello and welcome. In this video, we will discuss mental health. Firstly, there is no shame connected to mental health, and the condition is more common than you think. For example, serious mental ill health affects 2 people per 1,000 of the population. Severe depressive illness, 30 people per 1,000 people. Mild-moderate depressive illness and anxiety states affects 100 to 150 people per 1,000 of the population. Post-traumatic stress disorder, or PTSD, affects 30 people per 1,000. Having a mental health problem at some stage is not rare. The number of people with mental health problems has increased over recent years, along with child poverty and the number of food banks. It could be that modern-day living seems to be becoming more complex, with families under pressure, the cost of living and energy prices rising, with many people having to work more than one job to make ends meet. All this will cause more worry and stress for people of all ages. Mental health problems can begin at any age, and the following information in this video could help you now or at any stage in your future. You could be helping a close friend get through a difficult phase in their life and/or helping yourself. The age of 10 to 19 is considered adolescence and is a natural stage of life. This happens to everyone as they grow through their teens and become older. It is a crucial stage of development when teenagers undergo significant physical, emotional, and social changes. Unfortunately, it is also a period when mental health problems can emerge or worsen. People's experiences with mental illness can vary greatly depending on the disease's severity, individual coping mechanisms, support systems, and various other factors. If you are close to someone and you have noticed a change in their behavior, perhaps they are displaying one or more of the following conditions and may need help with their mental health. If you have been experiencing any of the following, it may be a warning of yourself developing mental health condition, and we would strongly advise you to talk to your parents, a close friend, or your local doctor. Several common forms of mental health disorders affect a significant portion of the population. Anxiety disorders, these include generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Anxiety disorders are characterized by excessive worry, fear, and unease. Major depressive disorder, MDD, also known as clinical depression, MDD is a mood disorder that causes persistent feelings of sadness, loss of interest or pleasure, changes in appetite or sleep patterns, and difficulty in daily functioning. Bipolar disorder, this disorder involves extreme mood swings, ranging from episodes of mania, elevated mood, increased energy, to periods of depression. There are different types of bipolar disorder, such as bipolar I and bipolar II. Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects a person's perception of reality, thinking, emotions, and behavior. It often involves hallucinations, delusions, disorganized thinking, and difficulties with social interaction. Attention deficit hyperactivity disorder (ADHD) is a neurodevelopmentally disorder characterized by persistent inattention, hyperactivity, and impulsivity that may interfere with daily functioning and development. Post-traumatic stress disorder, PTSD, can develop after experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, hypervigilance, emotional distress, and avoidance of triggers associated with the traumatic event. Eating disorders, conditions like anorexia nervosa, bulimia nervosa, and binge eating disorder are characterized by abnormal eating patterns and distorted body image and often have serious physical and psychological consequences. Obsessive-compulsive disorder, OCD, involves recurring unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, that individuals feel compelled to perform to alleviate anxiety or distress. Mental illness can affect people's emotions, thoughts, behavior, and well-being. It is important to note that these are general experiences, and individuals with mental illness may have unique variations in their emotional states and experiences. Taking care of your mental health is crucial for your overall well-being. Here are some ways you can prevent mental health issues and promote mental well-being for yourself and anyone you may know who is struggling with mental health. Prioritize self-care by engaging in activities that bring you joy and relaxation. This can include hobbies, exercise, meditation, spending time with loved ones, or pursuing creative outlets. Maintain a healthy lifestyle. Adopt a healthy lifestyle that includes regular exercise, a balanced diet, and sufficient sleep. Physical well-being is closely linked to mental health. Manage stress. Identify stressors in your life and find healthy ways to manage them. This may involve practicing stress reduction techniques such as deep breathing exercises, hypnosis, mindfulness, or engaging in activities that help you unwind. Establish a support system. Build a strong network of friends, family, or support groups. Having people who understand and can provide emotional support is essential for mental well-being. Practice good boundaries. Set healthy boundaries in your personal and professional life. Learn to say no when necessary and prioritize your needs without feeling guilty. Manage time effectively. Develop good time management skills to reduce stress and avoid feeling overwhelmed. Prioritize tasks, delegate when possible, and allow yourself time for relaxation and self-care. I hope you better understand how mental health is nothing to be ashamed of. If you think a friend or a family member is suffering, they are not unique and not alone. You could help them. Try to practice and begin to feel comfortable discussing your feelings, concerns, and challenges with trusted adults, such as parents, teachers, best friends, family doctors, or school counselors. If you have a friend or family member, don't be afraid to ask those awkward questions. Encourage them to talk to you about their feeling or persuade them to talk to a professional. Or suggest they Google the Samaritans. They offer free advice and guidance. They can also stay anonymous. The important thing is to open up and start to talk about your feelings. If you're experiencing persistent or severe symptoms of mental health issues, never hesitate to ask for help. A mental health professional can provide guidance, support, and appropriate treatment. Or, again, Google the Samaritans. There is a lot of free help and advice on the internet. Thank you for watching this video. I hope this will give you a general knowledge of mental health. Now please complete the short quiz. If you are unsure of any answers, you can rewind the video and watch any section again to refresh your memory.